Hey there, YouTube family. Welcome to Dr. G Pediatrics. In today's video, I'm going to discuss 5 early warning signs of autism. And at the very end of the video, I'll even go into the most important well-child checks for toddlers to help identifying a diagnosis of autism. So stay tuned. Okay, so autism, also known as autism spectrum disorder, is a neurodevelopmental disorder. And what's important to note about autism is that it's a spectrum. No one child is the same. No one child has the same signs and symptoms and behaviors. And so that is super important to take in mind. With that being said, there are signs that we can see in a child or a toddler that a parent may notice that may trigger suspicions for autism spectrum disorder. Number 1, I've mentioned this before, a lack of speech or no speech can be an early sign of autism. It's not uncommon for a toddler that ends up getting that diagnosis of autism spectrum disorder was first brought onto the radar because they were not speaking words, or by age 2 weren't combining words into 2-word sentences. So that can definitely be an early sign of autism spectrum disorder. That language delay, that lack of speech, or in some children, we can see early development with speech at 12 months, 15 months, 18 months, but then we see a regression in speech. So they were once speaking and then they are no longer saying those words, no longer speaking in a back and forth way. So that is an important early sign of autism. Number 2, limited or no eye contact. So a toddler or even a late infant can start engaging, making eye contact. That's how they really, for a baby, starts to identify kind of that social connection and interaction is by their caregiver's face. And so as an infant and a toddler develops more socially, we expect for them to engage with eye contact, being able to look at the parent or the caregiver for an extended period of time. Sometimes I may know in a toddler's visit that the toddler will just make brief bits of eye contact, but then looks away, or just seems to be just not looking at me at all. And so that lack of eye contact or limited eye contact can definitely be a sign of autism. Number 3, repetitive movements. And what I mean by that is a type of behavior that a child or a toddler may do over and over again. Again, no one child is the same, and they may not do the same repetitive movement, but some common repetitive movements that we may see is hand flapping like this, especially with excitement, just flapping the hands like that. We may also see a child that just may rock back and forth repeatedly. And then another thing is just a toddler that just might spin around in circles, just over and over again. And again, this is not to be taken in isolation, right? So there may be toddlers who may isolatedly, I'm not sure if that's a word, in isolation, they may flap their hands if they get excited. That doesn't mean your child has autism. But if this is something that's done just repeatedly over and over again, you know, for hours on end, or it's just something that just doesn't seem right to you, obviously, I would always recommend bringing that up to your child's pediatrician. So number 3 would be repetitive movements or behaviors that you may see your toddler doing. Number 4, delayed social development. this is a big key in identifying those signs of autism in a toddler. So what I mean by that is there are certain cues, just like with language, we expect certain milestones to be hit by a certain age range. So a child that may be on the autism spectrum may be delayed in those social development milestones. For example, not responding to their name. That's a big one. We expect a child to respond to their name being called by about 12 months of age. If your toddler's not doing that, that definitely can be a sign, an early sign of autism spectrum disorder. Additionally, pointing. So pointing in two ways. Pointing to indicate that they want something. So they want that toy, they want that snack. They're starting to point at it. They may not have the words for it yet, but we would expect a toddler by around 14 to 15 months to be able to do that. Also, not pointing because they want something, but pointing to show you that they're interested in something. So if they see a ladybug on a walk, or if they see pointing to an airplane that they may see in the sky, that's an important social milestone. So that your child or your toddler isn't doing that, that can be an early sign of autism spectrum as well. And then another one is what we call lack of pretend play. So a child at about 18 months, if you give them a play phone, they may pretend that they're talking on the phone, especially in this age. Everyone seems to have a phone or a cell phone. They may not know what a house phone is. So if you give a child that, they may not know what to do with it. But for example, a phone that looks like a cell phone, they would pretend, hello, hello, talking on the phone. Or if you give a baby, a toddler, a toy doll, they may start to feed the baby doll, like imitating that. So that we expect to see at about 18 months of age. So those are not all of the social milestones that we're looking at, but those are some important ones that if we're not seeing that in a child can be an early sign of autism in a child or a toddler. And number 5, since we're talking about toys, is playing with toys in an unconventional way. And what I mean by that is looking at this toy car. A toddler would take it and kind of just run it back and forth like this, whereas a toddler that might be on the autism spectrum disorder may just take the wheel and just spin it over and over again. So just playing with that one part of the toy and just spinning over and over again would be considered an unconventional way. Or if this child has this toy car and instead of actually playing with the toy cars, they just take the toy cars and line them up in a very neat way and can get upset if there's any disruption of their lined toy cars. Or if someone actually tries to play with the toy car and they mess up their line, that can be a big issue. So that is also a sign of autism in a toddler. So with that being said, that's not an exhausting list of signs of autism spectrum in a child, but it's important ones. If you're seeing this in your child or someone else has brought that concern, I think it's super important to have your child evaluated further with your child's pediatrician. Which brings me to what I think are the most important well-child visits to kind of clench or grasp that diagnosis of autism. So before I go into that, let's review the 5 signs that I discussed. A limited speech, limited eye contact, repetitive movements, delayed social development, and playing with toys in an unconventional way. When your child goes to their 18-month checkup and their 2-year checkup, there is something that is implemented, which is very important for potentially getting that diagnosis or that need for further evaluation, and that's called the MCHAT. That is a questionnaire that lists several different questions for the caregiver to fill out. We do it at an 18-month visit. We do it again at the 24-month-old visit. And that's important because a child may pass their MCHAT at 18 months of age, but then at 2 years, they may start showing more signs of that autism and then fail that visit at the 2-year visit. So those 2 well-child visits for me are super important because between 18 months to 3 years, there's a lot of social development that's happening for your toddler. And so that's a great well-child visit to address concerns, or if you may not even know or be aware of concerns, your pediatrician may be able to identify and observe your toddler and be able to say, you know, I think we need to go evaluate further for possible autism spectrum disorder. So 18-month visit, 24-month-old visit, super important. The MCHAT questionnaire should be administered at that time. And then the other well-child visit that I think is very important is the 2.5-year-old visit, the 30-month visit. There's some people who may miss that 2-year visit. So the 2.5-year-old visit could be a point where your pediatrician can then do the MCHAT. Or if you have a child where you were maybe concerned, they maybe passed their MCHAT at the 2-year-old visit, that 2.5-year-old visit is so important because then you can reassess. You can compare what that child was doing developmentally at the 2-year-old visit. They may have grown leaps and bounds by the 2.5-year-old visit, and the concerns may be no longer there. Or on the flip side of that, at the 2.5-year-old visit, when you compare what they were doing at 2, there might not have been much development advancements. And so that would be even more important reason for your child to get a further evaluation to see if autism spectrum disorder is what's causing the delays. So I hope you found this video helpful. If you did, please subscribe and share. Until next time, stay awesome. Have a great day.